Now we will study the glucose metabolism. According to the hormones related to the glucose metabolism, mainly two hormones are there which are released from pancreas, the endocrine pancreas, especially the insulin and glucagon. The insulin is hypoglycemic hormone and glucagon is hyperglycemic hormone. As we all know that the normal blood glucose concentration varies from 62 to 120 milligrams per deciliter in cat, dogs, horses, pigs. But in case of ruminants like cows, sheep, goats, it varies from 42 to 80 milligrams per deciliter. The adult ruminant has lower level of blood glucose. The control, I told you that the two major sources are there for the control of the glucose level is insulin and glucagon. The insulin hormone is related to hypoglycemia, and this hypoglycemia, that means it lowers the blood glucose level. It is a protein hormone having 51 amino acids in two chain. A chain contains 21 amino acids and B chain contains 30 amino acids. With this, they are joined with the disulfide bridges. Three disulfide bridges are there. One bridge joins A chain and another two disulfide linkages join A chain to B chain. This insulin synthesized as proinsulin, and it works by forming a glycogenesis. That means the sugar which is present in the food is converted into glucose, and this glucose is converted into glycogen in liver by the help of insulin. Another hormone is glucagon, and glucagon hormone secretes from the alpha cells of the pancreas, and this is related to hyperglycemia. That means it causes increased blood sugar via glycogenolysis and gluconeogenesis. That means it degrades the glycogen into glucose, as well as it forms glucose from non-carbohydrate substrates, and this causes increased blood sugar. And sometimes when there is disturbances in the glucose metabolism, there is a disease called diabetes insipidus taking place, and then the fasting blood sugar increases up to 125 milligrams, increase beyond 125 milligrams per deciliter. There is polyuria, that is glucoseuria, that means glucose appears in the urine, and this causes hemoconcentration, that is polydipsia, polyphagia. These are the symptoms which are normally found in case of diabetes mellitus. There is ketonuria, ketonemia also. Likewise, glucagon is again a polypeptide hormone having 29 amino acids straight chain, and this is again also formed from pre-proglucagon, and it is catabolic in nature. It increases when the low blood glucose level is there and causes gluconeogenesis via amino acids or via fats. It has lipolytic effect, ketogenic effect. It blocks the synthesis of glycogen by inhibiting the enzyme glycogen synthesis. In this way, it increases the blood glucose level.